Well, good morning and welcome to Just Talk with Justine. Today's episode is sponsored by Warriors on Water, Central Florida's only breast cancer survivor dragon boat team. And today I have a very, very special podcast. I have two guests with me today, and they are going to be talking about the Wisdom Study Group. And I have Allison Fiscalini, who is the director of the Wisdom Study. And I have Stephanie Goodman, who's head of marketing. So welcome, ladies, to my podcast. I appreciate you both being here.
Thanks so much for having us.
Thanks for having us.
You know, we're going to just start off with one of you gals. I don't know, Allison, if you'd like to start and tell me what exactly is the Wisdom Study?
Sure, I'd be happy to. So the Wisdom Study is a large trial that's currently ongoing across the United States, really with the goal of trying to understand and test a new way and approach for breast cancer screening. So it's a study for women who have not had breast cancer, but are of screening age, really trying to test a more personalized way of determining a schedule and a frequency of screening for breast cancer that's based off of individual risk factors rather than just telling everyone to come back every year starting at the age of 40. I think the knowledge that we have around the science of breast cancer, we think we can do a much better job of determining who needs to come in more frequently or sooner, but then also who may be able to safely come in less frequently.
So it's not made for those that have breast cancer, or
that's correct. Yeah. So it's for women who are being screened, and we do a lot of outreach and communications to the breast cancer community because they are our best advocates in terms of trying to get their loved ones to get in and be screened and to help educate others who maybe haven't had breast cancer about what they could maybe do or what your experience has been. So we do a lot of work with the breast cancer advocacy community to help us to get the word out to those who haven't been affected by breast cancer and hopefully will never be. So
through the community, women that have had and men, I should say, that have not had breast cancer or are not predisposed to it, how would they find out about this study? That's what you're saying, the community outreach?
Exactly. Yeah. So we started out recruiting patients and women who have been part of our recruiting centers across the country. And but in reality, we weren't getting enough people. And so we've been really trying to do more of a massive marketing and outreach strategy. And Steph can speak a little bit more to that. But really, we've tried to break down a lot of the barriers to joining a clinical trial. You don't have to come into a specific center. You don't have to travel. You can sign up online or on your phone and do everything that the study requires virtually. So it is something we've tried to make as accessible as we can and trying to make it as available as we can as well.
So, Allison, let me just ask you another question, if you don't mind. So, okay, if you're doing everything virtually to discover their genetics, I guess is what you're doing. Are you omitting a mammogram or a sonogram?
No, so women will continue to get their mammograms at their local centers, and we request the mammogram reports afterwards to make sure that they are clear, but also to understand what someone's breast density is. So there's a whole host of different risk factors that we take into consideration. It's not just genetics, it's breast density, it's age, it's your genetic background, whether you have a family history, age of menarche, et cetera, et cetera. There's a whole host of different risk factors that all come together to be able to determine someone's individual risk. And then based on that risk, we can then recommend a screening schedule.
Wow, that's really interesting. So is a doctor reading the mammogram and the sonograms that are performed at their local radiology places?
Yes, that's all part of standard of care. So the local radiology teams will continue to do the mammograms, read the mammograms, report back to the patient themselves, and then we just get a copy of it. And we use the information from that report to put into our risk models. So it's all, trying to use data and trying to use the care that's already being given and use the information to put into our assessment.
So the benefits of participating in the wisdom group are the fact that they are going virtually to do this study. And I'm sure you've got others.
Yeah. So really the benefits of participating, whether you participate in the personalized cohort or if you want to choose or you're okay being randomized, the comparison group is annual screening, which is we recommend a mammogram for everyone every year starting at 40. So the study is comparing those two groups, annual screening, standard of care, versus this more personalized approach where we have the additional risk factors that we use to determine a screening schedule. So really, everyone gets something out of being part of the study. You can learn about your risk. You can, get information about what risk level you may be at. If you are at a higher risk level, we have counselors and breast health specialists that can call and talk to you over the phone about what next steps you may want to explore with your local medical institution. That could be additional testing, additional screening, things of that nature. There could be chemo prevention medications that would be helpful to help reduce risk as well. So, and beyond the individual getting something back, really the ultimate goal is to be able to inform the guidelines and inform the field of study to help to improve breast cancer screening guidelines overall. We know that many women are still getting breast cancer despite increases in screening risks or screening schedules, increasing amount of mammography. We know that there are women in their 30s who are getting breast cancer. We know there's a lot more to breast cancer than just, it's not a single disease. There are many different types of breast cancer, and we know that we can bring some of that science around the biology of breast cancer to help us to inform our risk assessment and when to tell people to come in to screen. So really trying to integrate our knowledge, our scientific knowledge of breast cancer biology back into our screening assessments.
Wow, that sounds so interesting.
And I could add something to this too, Justine, if you don't mind. So when you ask about, the benefits to participating, when I speak to women about the study, I always talk about, like Allison said, learning the opportunity to learn your individual risk for breast cancer and or, whether you're at high risk arm and they're continuing to get annual mammograms, or they're in this personalized arm where they're getting personalized risk recommendations on how often to screen and what type of screening. Everyone in the study, if they are identified to be at high risk for breast cancer, they'll be alerted to that from our study doctors. And then they're empowered with that information, and then they can pursue risk reduction strategies like Allison mentioned. And so I think that that's an incredible benefit, because we go around, our lives with what we think is the best care, getting annual mammograms, but we never really understand what our risk is. And the Wisdom study integrates the best information that can be obtained. We're looking at women's breast density in their mammograms. We're looking at lifestyle factors. Everyone who enrolls in the study, regardless of which arm you're in the study, you fill out an online questionnaire once a year where you